computer. Yes, welcome, ladies and gentlemen. You are with Doctor of Psychiatry, my favorite person in the world. I'm having an intimate conversation with Dr. Agnes Bueno. Hi.
Hello, Jay.
Okay, so we're just going to remind everybody that you're having intimate conversations with Dr. Wow. Explain mo ulit sa kanila kung ano yung wow para talagang tumatak sa utak nila.
Well, it's an acronym for Woman of the World and Woman of Wisdom. That's why, it's wow. Wow. I created that a long time ago when I had a column with Lifestyle Asia magazine. So that's it.
Yeah, it's actually
that's why it's wow.
Yeah, it's a good brand because you are actually a wow, a real. I think when you come.
Can you imagine someone else to call herself wow other than Can you imagine person else who can?
Hindi, ikaw lang.
Dr. Wow.
Ang sabi nga nila, ang sabi nga sa pop culture, ikaw na.
Oh, ikaw na. Ako na.
Yeah. So,
anyway, what are we going to do today?
Yeah, it's interesting because you actually wanted to bring up some or clarify something as a continuing conversation with the last episode that we've had with you. And then you wanted to explain or expound more on the topic. Maybe we can start with that, Dr. Agnes.
Well, I think you mentioned something about porn. I failed to expound on that. Do you want us to tackle pornography? So, Jake, let me ask you.
No,
what's your impression of what porn is all about?
I think porn has helped me when I was single. If you're lonely, I mean, I think people who will deny or it's always been there. I know my parents were watching pornography when when I was younger. And I was very curious why I hear moanings, in the other room and said, what is that? And then in fact, oh my God, this is kind of private, but I remember we had an office on the ground floor, and then my father would invite his colleagues or his, his posse or his entourage to okay, we're going to have a porn party. And they would watch something on Betamax. And the reason why I know it was pornography is because the room was dark, and then the room was smoky, and I don't know why. I was wondering why is it a room full of men? It's not like, oh, there's a woman there, maybe they're doing something, but it was some sort of like a tribal experience for them to do it. Parang the way I see it was like how the tribesmen conglomerate, in the middle with a fire. Siguro it keeps them warm. And watching pornography for them at that time in the 70s was some sort of a ritual for them. Of course, I had interest kung ano yun. So sinilip ko yan one time. Sabi ko, ano yung pinapanood na yan? They were watching, I was able to snatch Deep Throat. I was able to snatch The Other Side of Midnight, which was R-rated. I was able to snatch.
Oh, that was a beautiful movie, though.
I still love it. I think it's a class. Yes. I think it's a classic.
I think profound.
It's profound. I think Noelle Page was beautiful. I love the journey and the decisions that she made in her life. She was glamorous at the same time, and she was a woman of the world and a woman of wisdom.
And the punishment that she had to get to be that kind of a woman, right?
Especially during that time.
Yes, of course. But see, what does it? the one you're talking about, the situation was, it's really more of curiosity, right?
It was
Really
curiosity. Then obviously when I grew up a little bit and I understood what it was, and there was no internet then there was always the penthouse and Playgirl and of my uncle. Oh my god. Oh my god, revelation. But and
those were mild, but the Hustler was more, crassy and crude.
Explicit, no?
Have you seen Hustler?
Yeah, I think once in a while I get to to see it, but and eventually there were VHS porn, and when I moved to Europe it was more available, but somehow it the VHS wasn't really doing anything because it's a very private moment between, so you can like satisfy yourself. But in Europe there are basements or sex shops in every corner of the streets in Germany. So, my knowledge about it became normalized, I guess, because it's normalized because it's available. So when it's available, you don't hide. You don't feel like you need to hide under a shadow or be incognito when you come out and you go to a porn shop and then participate. But in the dawn of the internet, it became more normalized because it's available. There's Pornhub, and because it's available, it had my taste became a little numb. Because it's available and it's not, and especially because I got involved in a relationship, I did not, I didn't need it, and I felt like if I do this every day too, my mind will be clouded with my, it's like nourishing my mind with sex all the time. So there's nothing wrong with that, but I'm just saying that if I had been addicted to it, which I have an addictive personality as well. So if I see myself getting involved with it way too much, I pull out because I say, okay, I need to turn the other way. That's my history with pornography.
Actually, you don't need pornography if you have someone sexy with you. But have you seen those live shows in Thailand or in Bangkok?
Live shows? No, I've never.
Live shows? No,
I've never.
Okay, so that's the other extreme, wherein it really affects your soul, right? Because it's really too much. But the other side, the one you're describing, Playboy magazine was a very pleasurable thing to read because they had good articles, and Penthouse is softer than Playboy, but Hustler is something else. So I draw the line between those two. Okay, one is beautiful, acceptable. The other is a bit for some kinds of men. Men who probably are more rough and tumble kind of guys, right? And then there's the cartoonized porn, which kids can access too. So you can just imagine the background in the mind when it comes to sex, when you are exposed with these things. Like on the other extreme, the live shows I shouldn't be mentioning countries also, no. In one country, and on this other end is the cartoonized porn. So they meet at the end, the extremes, no. So it's still better to remain in the midline.
Yes, midline. Yeah.
Yes, and then of course some get addicted to it because there's nothing else there. So I've had patients, women, wives, who their chief complaint would be that their husbands prefer to watch porn than have sex with them. See? So it's really a form of spectrum, and a disorder is just on the extreme part of all of these things. Okay?
Yeah, I have a question with that because so I'll take it on my personal experience with it, because if I had I don't want to use polluted, but if I if my mind is in pornography because of a suppressed feeling, and I ease myself, twice before relaxing with my partner, then I think the reason why I don't necessarily like it is because, first of all, you've already exhumed the energy. There is no room for imagination, and because you have images that sometimes are given or thrown at you, that okay, that is the sexy, and then the penetration. There's no intimacy. There's no sensuality that I see with it. The thing that's exciting is the chase, because you are watching two strangers. But eventually when you get with your partner.
But it's not even real.
Oo nga.
It's not even real. The deep throat thing, in-splice lang para ma-prolong. So the introduction of a lot of men is if they can have it for a long period of time, but that's not natural for men.
Oo nga. May editing.
So what happens is they think they're inadequate, and they feel like they should be doing it that way. And of course they get surprised that it's, they can never have it in real life.
Yeah, and of course, professional porn actors also have they're very well endowed, and it doesn't mean that maybe that's 1% of the population of the earth, or 2, or I think that's a very small percentage when you have an enormous phallus. Yeah, yes. So so you feel a little bit insecure as well. You have all these. You get this thing. Oh, I'm not. You're gonna be shy because you're gonna compare yourself to the porn that you had watched. So it's some sort of very, very, very. It does a lot of psychological things in your head, right?
Yes, I wish I could say it as it is. It can foul up your mind. It can really destroy. It can really destroy you if you're just into that. Okay, would be nice to just watch. Maybe if there's nothing else to do, but you can never use it as an appetizer or an aphrodisiac for your own sexual life.
Yeah. Yes.
So it's really just for show. Funny thing is, I've had this this patient, a gentleman, of course. He's such a nice guy. Naubusan ako ng what you call role playing, because he would ask me every now and then what role playing he could do with his wife. Naubusan ako ng scenario.
Ikaw din nagbibigay ng advice?
Oh, a lot of men, they come to me for problems such as how to deal with their wives sexually, how to make love in a sophisticated way. So sometimes I recommend yung role playing, which is more interesting kasi syempre you never want to routinize sex, right?
Yeah.
That's what marriage does to sex. It becomes routinized.
Well, what about communication? He can just directly ask the partner or his wife, what is pleasurable towards her or with her.
Well, naman men, they want to be the boss. So gusto niya, siya mag-initiate. And then susunod lang yung wife. So sometimes he runs out of of ideas and he comes to me. He has to make an appointment. He spends an hour with me on clinical time, so it's really a professional formal consultation. And only to find out from me if he did the right thing, if blah, blah, things like that, and what else he can do to role play.
I have a feeling he gets on with that. Actually, he gets turned on talking to you, so that propagates him.
Sometimes I am a little paranoid that, teka muna, baka naman gusto lang niya akong makita or gusto lang niyang...
No, I think that's natural.
I get a little paranoid a little bit.
I think that's kind of natural, that if you become open about those things to somebody, you do sort of like share your thoughts, and somehow that becomes like it turns on something in the mind, or maybe your dopamine gets excited or gets boosted, because you're talking about something that's normally shared between two people who are having an intimate relationship. But of course, a psychiatrist and a patient already have that kind of intimacy, because you've broken a wall, right?
Oh yes, it's more intimate than anything else.
Hang in there, doctor.
Pardon?
So yes, the relationship between the psychiatrist and the patient is very intimate.
It's more intimate than anything else. Even it cannot be surpassed by anything, not even a confessional. I'm like a priestess, actually, if I see patients.
Why do you think that is? Is it because first of all, you're talking to a stranger?
No, it's really professionalized, actually. So they bring in their deepest problems, and we have to dig layer by layer for him to understand why he is something as simple as insomnia. When it's just a symptom of a deeper problem. See, so it's really profound, actually, to be a therapist. You really need to know what you're doing, otherwise you might mess it up all the more. So when we call that transference. For example, the case I'm talking about, you call that transference, and we have been trained to deal with that. So, for example, if I notice a patient to be falling in love with me, for example, then I have to confront that also, so that he understands what's going on with him. Okay, so that's.
I think what you're saying is
what
that
we call transfer.
Baka ang sinasay mo is that madaming na in love sa'yo.
Yeah, the men, as I say, they're very easy to fall, and especially when I'm trying to help them. The best person to teach a man how to be a man is a woman, not another man. It's a woman. So when they come to me, they notice that they become more men, and they learn how to be more of a man than anything else.
Well, it's also because
like this particular case of mine, he really, really, really appreciates my suggestions, and it has improved his marriage. Although sometimes I wonder why he has to come and see me again, only to ask me, what else can I do, Doctora? Because my wife might be getting bored, something like that. So, makikipag-appointment, and he will pay me so much whatever time because I charge per my time. Ibubook niya ng mga 2 hours para he can have 2 hours with me. Para akong prostitute.
no.
Binabayaran ako para makita ako, or to talk to me. And some prostitutes do that. The client does not necessarily want to have sex with them. They just keep talking, and the prostitute listens. So she's like an auxiliary therapist. Kasi many guys don't know how to go to a psychotherapist. Kasi our culture stigmatizes them as maybe they're crazy. That's why they're seeing Dr. Bueno. So that's why I had to set up that clinic para mahiwalay yung mga psychotic, yung talagang grabing and this relationship problem. So I separated the two.
Yeah. Well, intimate conversations are very stimulating too. So I think that's where you're coming from. No, I mean, so when people discuss or seek advice, with that's pretty for me. That's very, very personal. It's like a discussion on dinner table. Like all of a sudden, let's talk about fellatio. How can I improve giving fellatio to my partner? I mean, so when you discuss that in a group, or or even for example, you happen to chance upon having a guest in your dining table, and then all of a sudden you hear your guest talking about fellatio out of the blue, it could, you could feel a little bit uncomfortable. Why are we discussing about pornography now? You know that there's a couple right before you. I find that a little bit.
Yeah, that's why in the beginning I told you, an intimate conversation is a special thing. It's almost like what I do in therapy, wherein you have to bare your soul to the therapist. I've had patients who are religious persons, all kinds, and they need to be helped. Whatever.
Well,
them.
Yeah. So
and by the way, we psychotherapists don't give advices. We have to. It's more of the medical model wherein you treat. You treat. Ang advice kasi is you base it on your own experience and then i-advise mo, di ba? Ganun yung mga nag-a-advise, di ba, sa radio or TV. Yung psychotherapy is different. It's not giving advice.
I see.
It's really getting into the core of the problem.
So I think my next question is, so now that, because we started a conversation with pornography, and that when somebody seeks advice on, for example, with seeking of advice how to give pleasure to a partner, will you recommend, manood ka na lang ng porn?
No.
Okay.
Because porn is deceptive, as I was saying, It's nice. Like if you watch soft porn, it's nice to watch it, but not in an addictive way, or not the contrived one. Like Deep Throat, for example. It's not real.
Punta tayo sa 21st century. Meron kang nakita sa Japan. Ano ba yon? Viral?
No. It's a cartoon. It's a cartoonized porn. Because if it's cartoonized, you can create monsters having sexual intercourse and all that, and that's being viewed by kids.
Oh, really?
Ako mismo, I'm old, but I was grossed out. So how on earth can you come up with something like that? Isn't it right? That distorts it so much. Iba naman yung bondage, Ang dami bondage, SNM.
Yes.
Yeah. I'm treating you like someone who's just a little boy. I have to check if you have seen those things, or about those things.
No, you'll be surprised, madaming hindi nag-explore ng mga ganito. Honestly.
Oh, good. Right. Yeah.
And I'm always coming in as a fresh slate. Parang wala akong alam. I really want to know. Sige. Para din ma-advise natin sa mga pamangkin natin, di ba?
Oo nga. Pero, the earlier that they know about sex, the better. You see, that's another thing. Sex education starts from birth. Hindi yung sa school lang. Ano bang pinag-aaralan sa school is just the anatomy of it, and that's it. There's nothing about the real thing about sex. So, see, so it's really the societal thing that makes it. I don't know. See, that's why I'm a bit passionate about it, because I'm just one voice in the wilderness, I guess.
Yeah, but I think you pointed out something very interesting. No, sabi mo kanina that you have to teach boys at a very young age. Remember?
Yes, at a very young age, so that you create or you bring up boys who are going to be gentlemen, who are going to respect the woman's desire, who is not going to force himself in, who's not going to treat a woman like an object. See, you start from, kasi 10-year-old boys are already aware of being somewhat attracted to a female. Di ba? Ganun yun eh. Grade 5 pa lang ako, nililigawan na ako, di ba?
Ayun na nga. Sige, inom ka muna, doktor. Mukhang ano ka doon, na-dehydrate ka sa ating conversation.
Kasi parang I'm still exploring it also with you.
No, it's fine. It's fine.
Yeah, so that
you need to drink more water?
Clear, right?
Do you want to drink some more water?
So dapat, ang sex education starts early by someone who is comfortable about it. Not teaching it in high school na, or tapos anatomy lang, the sperm and the egg, they meet, blah, blah, ganun lang, right?
Yun na nga eh. Kasi di ba ang hot topic ngayon, hindi naman hot topic, is that it's always, you hear some people, yung mga, especially yung mga, I mean, ignorant, I don't want to define people, but sometimes, sometimes some people are really ignorant. Like, for example, they would make a statement na pag nakakita ng isang babaeng naglalakad dyan na dapat hindi ka magsuot ng mga ganyan kasi marirape ka, yung mga ganyang biro ba? I think you also have to educate the young boys, about the women's anatomy, and it's not the girl's fault that I don't know what do you think about it?
It's not your fault if that's your anatomy, isn't it? And if you observe men who are watching, people just walking in front of him, you will notice na maski whatever the woman is wearing, yung mga mata nila nandun sa breast, nandun sa crotch, nandun sa behind. No matter what the woman is wearing. So, hindi mo ba...
Parang kultura yan eh. Pagka nadaan ka dun sa mga tricycle driver dun sa may isang tanod, no? Tapos medyo sexy ka lang na padaan dun, nautusan ka lang ng nanay mong bumili ng sachet ng sachet ng shampoo, tapos bigla na lang, a teenager all of a sudden who's blossoming into a woman in her pubescent puberty stage, bigla na lang nasipulan. Kasalanan ba yun ng babae?
Oy, ano na ngayon? It's already against the law on catcalling.
Oh, fantastic.
They just passed it. Yeah, I think it's now a law.
Yeah, I heard about it.
Bawal yun. Pwede ka na makulong.
Oo.
So ako, I don't mind na mag-catcall ka, wag mo lang akong i-touch. Mag-catcall ka hanggang umaga, okay, I'd appreciate it, pero wag mo akong i-touch.
Yeah.
Diba? So, it's really the grooming, the introduction to these matters. Kasi kung sinabihan mo yung bata, oy, masama yan, ala, pupunta ka sa impyerno, ala, magkakaroon ka ng buhok sa kamay mo, or whatever. So, syempre, yung maliit na little boy, my gosh, can you imagine, mag-create na yan ng ang dami-daming disorders sa kanyang mind. You don't do that to young kids. You just say it as it is, and you don't underestimate their intelligence and their capability to discern. See, So, pag naging adult na, or pag the hormones come in, you know, like if the hormones pump in, aba mag-aano na yan, mamimilit na ng babae, manre-rape na, maninilip na. Yung lahat na ng psychiatric disorders, masushoot na siya doon. See? So kung ikaw, you were brought up in a manner na, well, okay lang naman yung mga ganyan kasi that's life, or you know, you say it as it is, without malice, without fear or castigation. Eh, hindi naman siguro mag-groom ang society or ang mundo ng puros mga ganon. See? So, as a professional dealing with the results of those practices, of course, i-recommend namin whatever should be better, isn't it? So, even lawmakers should be asking the opinion of psychiatrists and child psychiatrists before they can sponsor some laws about those matters, di ba?
Yeah.
Hindi naman yata tinatanong ang mga professionals about those things, isn't it? So, yeah, those are the things I see in my clinic. That's why I know what to say.
Well,
hindi
yes.
naman nila nakikita yung resulta, kundi kami lamang na kami ang hantungan, di ba? We are the end point of those disorders.
Yeah.
So pagka binalikan mo, hinalungkat mo, ganun pala yung upbringing kasi. See? So, maiintindihan mo kung ba't siya ganun. Right?
Ang maganda ko nakikita niyan is that, you know, if we could have like this kind of conversation, or, you know, we have the education also to the public schools, so that the majority of people who are not able to invest in private schooling will also benefit the things that are taught in private schools, because majority ng Pilipino nasa public school so dapat meron din tayong matatatag na psychiatrists or guidance counselors in the public school system that will be able to educate the
Nakakatakot din yan kung hindi talaga trained yung teacher, kasi baka naman disorder yung teacher na yan, see? So, kailangan meron din nagsusupervise dyan sa
ano ba ang yan?
So, I feel like it's better to educate your kids about sex.
At home?
At home, yes. You know, the way you deal with your partner in life, makikita yan ng mga bata. So, they will model after you. See?
Okay.
So, if you're comfortable with kissing, for example, you're affectionate, syempre, they will imbibe that, and they will also become affectionate, isn't it? But if you're cold and you're cruel, so they will also become that way, kasi ikaw lang ang pagmamanahan nila ng behavior na yon, right? So, so you better believe me when I say so.
Yeah. Well, that's 40 years of experience too with being a teacher and in your practice. That's we're very fortunate to hear this from you. It's a very interesting topic. If you find this interesting, ladies and gentlemen, please give us a direct message, because you guys are involved in developing this program, Intimate Conversations with Dr. Wow. All you got to do is give us a direct message, maybe questions that you'd like to ask. Since we are not doing this live yet, we may receive your direct messages, and then we can explore the topic or give you the answers on the next episode, since we're not doing live yet. I think that's pretty, first of all, I really want to say that this whole setup, it's a good thing we sort of like paused the episode kanina in between, so you don't see that. But sometimes when there's something coming in, I have to correct Dr. Agnes, because Dr. Agnes, is new to this medium, no? So she was using natural light, if you notice in the beginning of the program, and in the middle of it, because makulimlim na, and the rain it's overcast outside.
Yeah, it's raining now.
So it became a little dark. So that's the thing when you depend on the light outside.
Yeah.
But
Yes.
that's what happens because you become, all of a sudden you have no light. So sabi ko, we had to pause the episode, and then, you know, as you see, as we progress, may lighting na bigla si Dr. Agnes Bueno. But thank you for sharing your time. Teka muna, mahaba palang book mo.
Oy, oo naman. Mahaba yan, no?
Oh, nice. Can I ask you a personal question? When did you stop coloring your hair?
I never colored my hair.
So when we had a date in your centennial thing, was that
Oh.
that wasn't white?
Oh, I had some. What did I have? No, my white hair was already growing out at that time.
Pero konti lang.
It's not as white as this.
Well, that's nice because it's silver eh.
Oo nga. Yeah.
Diba?
Yeah.
Silver na nagbablond.
My hair has gotten so long because of the pandemic, but I like it long.
Yeah. Para ka talaga si Brigitte Bardot.
Ay nako. I wish.
Yeah, well, thank you. Thank you for this. And then this is to entice the people who are listening that we're definitely bringing you intimate conversations with Dr. Dr. Wow every single week, once a week. And I can't wait for October 1 because start from October 1, we have the beta version of the guest feature, meaning Dr. Agnes and I can actually go live on my Facebook. This is very exciting. Yeah.
Great.
So she doesn't have to be an eCam Live member or any guest. You can feature any guest. Just send them the link. I'm not an endorser of eCam Live, but I really believe in the product. It's a software developed specifically for Mac users. So come October 1, we'll be having that. So look forward to that. So yes, so if you have any questions, if you have any suggestions, we'd love to include you in the process of developing my program with Dr. Agnes Bueno.
Okay.
Well, see you next time, Agnes.
All right. See
you.
Bye.
Thank you. Yeah. Yes. Oops, my hair.